So this is also an area of where, a lot of clinical trials are ongoing now. But for standard of care, we always want to know what their genomic sequencing status is of the tumor. So this is also an area where the knowledge or know-how about the genomic sequencing of their tumors matter. For instance, if they have, let's say, sequencing results that show FGFR alteration, then we can use erdafitinib, which is an FGFR inhibitor, for instance. But that would capture probably only about 20%, of patients, because not all patients would harbor a mutation that you can target. So for the rest of the patients, we have currently 2 standard of care options in terms of ADC. So that's antibody drug conjugates. So one is enfortumab vedotin. I just shorten it to EV. Another one is sacituzumab, which is SG. So both of them are ADC, so antibody drug conjugates. So they're not really similar to immunotherapy and not really similar to chemotherapy, but I would say probably a little more similar to chemo because there's a payload. And there's an antibody target. So meaning EV, for instance, the target is Nectin-4, whereas SG, the target is TROP2. So once you deliver the drug, what it'll do is seek out the antigen, and once it binds to it, it will release the payload that is a chemotherapy equivalent, if you will. So it's more a targeted therapy or treatment in a way. And they are both approved, in patients with metastatic urothelial cancer, typically after progression, from prior standard of care treatment. So for instance, a patient who has seen chemotherapy followed by avelumab maintenance now is progressing. So that would be sort of the next line of therapy. And understanding the side effect profile of each of these drugs also matters. So for instance, if you have someone who is brittle diabetic, have high blood sugar, EV would require a lot of monitoring because hyperglycemia is a prominent side effect, for instance. Whereas someone who has a lot of issues, frailty, of course, myelosuppression can be a big one with SG. So a lot of appropriate monitoring for these patients, especially in the second line and beyond treatment line setting. And again, my pitch has always been clinical trials, so if there was an appropriate clinical trials for such patients, then that ought to be considered, as well.